Hi guys, Danny here at Grant Health. Now today I want to talk to you about cholesterol. It's such a widely discussed and debated topic over the years, and it still remains controversial today. So I want to spend the next sort of 5 to 10 minutes helping you understand it to a deeper level and to help you understand why it's been so controversial over the years, okay? So I think it's important that we start with the basics, what it is, how we use it. I promise you the juicier parts will come later in this video, but I think it's important that we start with the basics, okay? So when we think of cholesterol, we automatically start thinking of things like heart attacks and strokes and cardiovascular disease. And you've probably heard of someone wanting to remove or reduce cholesterol from their diet, which doesn't make it sound all that important to the body, right? But nothing could be further from the truth. In fact, it's so important to the body that every single cell we have has the ability to produce and manufacture its own cholesterol, okay? Why? The first reason is because of our cell membranes, okay? So each cell in the body has a cell membrane that coats it, and it's this membrane that gives the cell structure and shape and formation. This membrane allows things to get into the cell, so things like nutrients and hormones, and things to leave, okay? So things like toxins and debris. So this cell membrane that coats every single cell is actually made up of cholesterol, okay? So this is the first reason why every single cell makes its own. The second reason why cholesterol is used in abundance by the body is because of our sex hormones. So our sex hormones are things like estrogen, testosterone, cortisol, progesterone. They all rely on cholesterol in its formation and production. And the third and final reason I'm going to give you today is because of digestion. So bile and bile acids that we use to digest fats, they are made from cholesterol as well. So those are your main 3 reasons why we have cholesterol. There are a whole bunch of other reasons, but those are your 3 for today. Now, clearly, it's a very important molecule and compound in the body, and it's vital to our existence. So why doesn't it stop there? Why is there so much controversy around it? Well, the first thing to say is that whilst every cell can make its own cholesterol, not every cell can make enough cholesterol for itself. And this is where the liver comes into the picture. The liver has the ability to make enough cholesterol to support other areas of the body that can't make enough. And the second thing to say, the second issue, I guess, is the fact that cholesterol is what we call hydrophobic, which means that it's not soluble in water. So basically, the liver can't just push cholesterol into the bloodstream and push it to the other parts of the body that needs more of it. It actually needs to be sort of transported by something else. And this is where HDL and LDL comes into the picture. HDL stands for high density lipoprotein, whereas LDL stands for low density lipoprotein. And the way you want to kind of look at this is they're just acting as ships or boats, okay? So HDL and LDL aren't actually cholesterols. They are proteins and different types of fats, which acts as the boat, which acts like a ship. And it carries cargo, i.e. cholesterol, through the bloodstream to other areas of the body. So we have HDLs and LDLs, which are often dubbed the good guys and the bad guys, right? Because HDLs usually take cholesterol away from the peripheries and back to the liver, which is then recycled and therefore not too harmful for us. And then you have LDLs, which takes cholesterol to the peripheries, where it can potentially contribute to atherosclerosis. Atherosclerosis is that technical term to describe the narrowing of the artery walls, right? And it's this narrowing of the artery walls that can increase our risk of a blood clot, which would then lead to a cardiac event like a myocardial infarction or a stroke. But is it as simple as that? Is it as simple as HDLs are good for us and we need more of them, and LDLs are bad for us, and the more of that we have, the higher our risk? Unfortunately not. You see, on a standard blood panel that you might get from your doctor or your GP, we are actually only privy to what I call, quote unquote, our preliminary numbers in terms of cholesterol, so just our HDL and LDL. But when we want to assess and evaluate somebody's overall and actual risk of a cardiovascular disease, we have to look a little bit deeper. And what I mean by that is looking deeper into LDL and understanding that LDLs actually come in two different sizes. You have a larger, more buoyant particle size, and then you have smaller, more denser particle sizes. And it's the more smaller particles that we need to be more careful of, because they will have a much higher propensity in lodging its way into our artery walls and sticking and squeezing into there. So the first question is, what is that ratio of LDL particles? Because again, on a standard blood panel, you might see your LDLs raised, but that could be just a larger particle size, which poses less of a risk. The second thing to understand is, well, actually, how does plaque formation happen in the first place? Now, we know that plaque formation, i.e. the narrowing of the artery walls, starts from a pretty young age, maybe as early as late teens to early 20s. But the speed of which it happens is influenced by a whole host of factors, namely being overweight, high blood pressure, smoking, and generally leading a pretty unhealthy lifestyle. And what happens is, when we have those things present, we have inflammation present. And when we have inflammation present, the LDL particles that are actually stuck in the artery walls become what we call oxidized, and that can create plaque. So we actually need a bit of a perfect storm, if you like, or perfect recipe for the artery walls to narrow. We need inflammation that generally comes from, like I mentioned, high blood pressure, being overweight, and we actually need high amounts of these smaller, dense LDL particles to be lodged inside artery walls for atherosclerosis to take place. Which is why, if you are seeing a high LDL on your panel, then it's really important to investigate a little bit deeper first before panicking, and just understanding the ratios between the larger, buoyant particle sizes with the smaller ones. But then also making sure that you're staying on top of your metabolic health. So things like your weight, your fasting glucose, your insulin, your blood pressure, your triglyceride, and just making sure that they are all in a very appropriate place to minimize inflammation, which is that sort of first thing that sets the scene for atherosclerosis. The other thing to mention is that if you are seeing a high cholesterol on your panel, then it's important that you rule out other conditions that are linked with high cholesterol, i.e. hypothyroidism or PCOS. And finally, I just want to quickly talk about how does the cholesterol that we eat influence our overall cholesterol levels. So to put things into context for you, we typically only eat about 300 to 500 milligrams of cholesterol per day, whereas our overall load or pool of cholesterol in the body is somewhere between 30 to 40 grams. Okay, so the cholesterol that we eat in our food pales in comparison to the amount of cholesterol that the body holds. And not only that, only about 10% of what we do eat actually makes its way into our cholesterol stores. Okay, we get rid of most of the cholesterols that we eat through our bowel movements. So dietary cholesterol doesn't seem to influence our overall cholesterol levels by any significant degree. However, what we do know is that high levels of cholesterol, alongside some of these other risk factors that I've mentioned, so high blood pressure, excess body fat, seems to be that perfect combination to progress atherosclerosis. So if you are in that camp, or perhaps in a situation like familial hypercholesterolemia, a genetic disorder of high cholesterol, then it might be sensible to monitor your dietary cholesterol or saturated fats. I hope this video has been helpful. If you have any questions, do let me know.